and some education. We're going to tonight. What we're going for is just a fun conversation to help folks get out from underneath shame, to have some education, to ask some questions. Maybe we got some questions to kind of get ourselves started, and we're just going to see where the conversation goes. So I'd love to. I'll just share a little bit about myself. I work with Lamont at Better Way to Meet. I'm also a licensed marriage and family therapist and also a certified sex therapist. So I work mostly with gay men, working through all kinds of issues related to sex, relationships, intimacy, etc. And Dick's eggplant comes up a lot in our conversations.
You gotta take a shot, Josh. You gotta take a shot.
Sorry, Instagram. My bad. So yeah, I want to just give a chance to our other panelists to chime in about who they are and kind of what their background is.
Sure, I'll start, I guess. So I'm Jeremiah Robinson. I'm a PA here in Atlanta, Georgia. I'm a gay men's health specialist, HIV specialist, LGBTQ health specialist, right here in Atlanta.
And eggplant comes up a lot in your practice as well, I would imagine.
How many eggplants do you see a day, Jeremiah?
I need a scientific calculator.
Other than yours.
Depends on what you mean by coming up.
Say more.
Which might be one of the problems we should talk about.
Aaron, you want to introduce yourself?
Yeah, so I am Aaron Kimball. I am a sex therapist, licensed professional counselor. I work with, eggplants all day. Talking about eggplants from PE, which is premature. Can we say that? Can we say premature ejaculation?
You can say ejaculation all you want. Yes, Aaron.
Beautiful. To, all sorts of things. Low desire, high desire, mismatched desire, LGBTQ concerns, and, everything else in between. So great to be a part of this panel.
And if you all don't know, I'm Lamont White. I tell people I'm the gay dating coach because I teach gays how to date, to find love and stay in healthy relationships. So once a month, we're going to be having discussions that really impact our community. So I have these great guys here who are going to have us walk us through a conversation. Before I turn it over to Josh, because I know the people in the comment section, I know they would like to know if any of you are single, if you're dating, they want to know, because I keep seeing, oh, it's a cute white guy with a beard. Who's this other guy at the top? They like all three of y'all. Okay, so are you all single, dating, in relationships?
So we're going to turn this into Shoot Your Shot Wednesday all of a sudden.
They want to know. They can slide in that DM.
I'm single and dating, and so yes, I'm available, but I'm also helping other folks find their matches as well. So yes.
So yeah, I'm partner for about 7 years, and yeah.
So leave Jeremiah alone, people. Don't slide in his DM. I don't want his husband coming at me trying to kill me. Okay.
Yeah, and I'm partnered for about 7 months, 8 months.
8 months? I think. Okay. So Josh is the only single one, y'all. Y'all can slide in his DM. I don't think the other two are looking for unicorns. So move on, okay? All right, Josh, I'll turn it over to you.
All right, back to the eggplants. So our first question, I'd like to get us started. We got a number of questions, and if we don't have time to address them all, we'll just have to come back and do more. But the first question I would like to pose to all of us is, what eggplant issues do you encounter the most in the work that you do? Let's start, Jeremiah, with you. Let's come back to you. You started talking a moment ago about that.
Yeah, I don't think it's a big surprise. I mean, erectile dysfunction is probably the number one thing. I think, and I see this in guys in all ages. And a lot of times people think, well, it's when you're older. Yeah, no, I have 20-year-olds who have issues with ED, and it's pretty common.
Yeah, absolutely. Aaron, what about you?
Yeah, similar. Performance anxiety, which is a huge, thing. Premature ejaculation, definitely ED, so erectile dysfunction, and then honestly, a lot of guys, specifically mismatched desire. That is a huge issue.
Yeah, for sure. What about you, Lamont?
Yeah, so hopefully y'all won't kill me for this or hate me for my response, right? So I do matchmaking, and typically, like most gay men who are in long-term relationships, there's some versatility in sex. Like rarely is it like a strict top, a strict bottom. So guys come to me and they're like, "Oh, I'm a strict bottom." And they're like, find me a man. I'm like, well, bro, you have to give that peanut up a little bit, at least like on the guy's birthday, on Christmas, like at least once or twice a year. And they're like, well, I don't know if I can do it. And so I try to unpack it. I'm like, let's talk about this. Is it more about like performance, like physically? Like, is it something that like your eggplant just won't rise to the occasion? And I'm like, if that's the case, you can just take, Cialis or Viagra or something, and then boom, there you go. Give him some D on his birthday. Others are like, well, if I penetrate a guy, they're no longer turned on by him because they're like, they have this fantasy that, like, if you penetrate a guy, he's no longer attractive anymore because he's more feminine or submissive. And then I'm like, well, let's unpack that because we can unlearn some of those internalized homophobia like characteristics that we've been taught as gay men. So I would talk about performance or the internalized homophobia that you can kind of get over when we talk about like your penis like getting hard. Yeah.
Yeah, for sure.
Mhm.
I'd say for me, the things that come up the most, I echo what some of the other guys said. Mismatched desire. I saw a comment that asked, "What the hell is a mismatched desire?" That's when one partner has a high sex drive, the other has a low sex drive, and it's become an issue in the relationship.
Yes.
That's what we call mismatched desire. Definitely erectile dysfunction, either circumstantially, which is like right at the moment where you stick it in, it goes limp then, or having difficulty anticipating performance. That anxiety causes that eggplant to go down. I would say rapid ejaculation or premature ejaculation, as well as delayed ejaculation, are things that come up a lot for me in the work that I do with men. And would love mainly the thing that I have come to learn is that anxiety is the number one boner killer. And aside from, every now and then there is a medical issue that a urologist or a medical provider does need to address, but 99% of the time it's anxiety, almost always. And one of the things that I tell my clients is that, part of what's happening in that anxiety moment, I'd love to hear the other guys chime in on this, is that when our brains sense anxiety, it interprets it the same way it would physical danger, that sort of base part of our brain. And so what happens is it thinks, oh, anxiety, that means danger. That means I need to trigger the release of adrenaline, cortisol, other hormones that reappropriate the flow of blood out of the eggplant and reappropriate it elsewhere to prepare for fight, flight, or freeze. You
Yes.
know, and so that's kind of, our body thinks that it's trying to help in that moment because it senses anxiety. And so a lot of the work that we do is helping people get out from underneath their anxiety when it comes to those sexual situations. So,
Yeah.
what about y'all? Does that come up with you all? At
Mhm.
all?
Yeah. Oftentimes, a lot of my clients, particularly, will shut down in situations of anxiety. That's the body's way of protecting itself. We shut down. The concern about that is sometimes we have partners, we have sexual partners that unfortunately don't give us the support that we may actually need. And so this continues that whole cycle and perpetuates that whole cycle of anxiety. So, with that, I think it's very important for us to be able to articulate when we're having anxiety surrounding, not being able to quote unquote perform, even though I don't like that word. We'll use it for this.
Yeah.
Mhm.
I think that too, sometimes it takes is one bad encounter or one bad experience that can leave someone traumatized. Maybe they were with someone that was a little bit hurtful or, made them feel a certain kind of way about it. And it's so hard to, you know, uh, unwire that. Um, so I do see that in a lot of patients who, you get into the meat of really what's going on there, and they'll tell you, oh, there was this one time where, I couldn't get an erection and this guy made me feel a certain kind of way. And that's tough. That's a little bit harder to overcome. And I think that's where, sex therapists would be very helpful.
Mhm.
Yeah.
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 There was a question. Someone said, "How do people get over their anxiety? Is there talk therapy? Like, what would you all recommend?"
I mean, one of the things that I try to help folks do, especially if you have a regular partner, either a relationship or a regular friends with benefit, some kind of regular partner, that to be in conversation with that person about what's going on, so that you as a team can kind of collaborate on it. Because as it turns out, the eggplant is not the only part of the body that experiences pleasure. So one of the things that we want to do is shift focus away from the eggplant onto the entire rest of the body.
Yeah.
And sometimes when we just sort of let the eggplant sit out for just a moment and rest, it'll come back online by itself automatically, And so we want to shift focus away from it, not talk about it, not look at it. Oh my God, I'm so sorry. No, no, don't get into an apology, tour about it, but that we just shift focus to something else and kiss or play with nipples or, rim somebody, whatever. There's a whole menu of other options for folks to choose from. So that's one of the things that I offer folks. What about you all?
Yeah, I mean, and Josh, I think you hit the nail on the head. And I don't know if Jeremiah, thinks the same way or similarly. However, I tell a lot of my clients, I suggest, I don't tell, I suggest to them that the orgasm is not necessarily the be all end all. What about pleasure, as you mentioned, Josh? What about touch? What about really finding out what it feels like to be flirted with or have some type of foreplay? Like that is all encompassing within the sexual experience. It doesn't just have to be, oh, I'm going to get mine and go.
Mhm.
Yeah.
Also having someone that you feel comfortable with, that you have a certain level of trust, and I think just having that base there, that this is someone that I can be vulnerable with, because not every sexual partner that you have, you're going to have that experience with. So finding that partner that you can explore these things with, and it's okay if you're not on all the time. I think that's probably very important if you are having those kind of issues. Maybe you need to explore outside of your normal sexual experiences.
Yeah, I always recommend, I know it sounds simple, but like literally taking a deep breath. Like if you're anxious, there's some anxiety, you got to take, sex is supposed to be enjoyable. And sometimes your body can confuse anxiety with excitement, right?
Mhm.
And you're like, oh, I'm excited. Am I nervous? I don't know what the hell's going on. So just take like a deep breath, relax, and then that'll get you back in the mood. Okay. Someone there was another question. And you all can use the question function or put them in the chat. Someone said, "Is hard drug use and heavy alcohol use does it also affect your limp eggplant?"
Eggplant.
Yes.
I see you nodding, Aaron. Go ahead.
Yeah, absolutely. Just thinking about, the physiological effects of any type of drug, alcohol. Think about what it does to your body. Think about what it does to your mind. So, absolutely, it's going to inherently affect the, eggplant, banana, whatever we're calling it right now.
You've heard of whiskey eggplant, right?
Yes.
Exactly.
Yes. Yes. Yeah.
Great flavor.
There is a question. Someone said, "Henny eggplant is a real thing. Does drinking make your penis soft?"
Yes.
And yeah.
Okay. Okay.
I mean, it can't. I mean, yeah, there's other factors I think that play into that as well. I mean, how turned on is somebody in a given moment? So sometimes, the brain is the most powerful sexual organ that we have. And so if we are really into somebody and we've really kind of built up that sexual energy, and maybe I haven't busted in, a few days, there's a lot of other factors that build up that sexual tension, which can really sort of, help mitigate that a little bit. But if you've busted 4 nuts already today and you're trying to hook up with somebody and you had a couple of drinks, you might not have given your body enough time to kind of build that sexual energy back up. For men, there's this thing called a refractory period, which is sort of the time it takes from one ejaculation to the next, where the body kind of recalibrates itself, sort of reloads the gun, if you will. And there's a lot of biological diversity around how long that takes. Some men it takes 10 minutes, others it takes 2, 3, 4 days. But when we have a chance to kind of let that tension kind of build back up, we're sort of in a better we set ourselves up for better options then.
So someone
But-
was saying like if they're bottoming, like alcohol actually helps them to be able to take a little bit better.
Mhm. And guess what we're going to be talking about next month?
Cakes. Peaches. Yes.
Yes, we'll be talking about all things peaches next month.
Yes. Someone said, how do you deal with diabetes and erectile dysfunction?
The number one thing is to get your diabetes under control. That's really the best medical advice I can give you. Outside of that, talk to your medical provider about what options you have for ED, whether that's, Cialis, Viagra, or maybe you're someone who needs something more like an injection. There's a lot of other options, implants and things that for people who really struggle even with some of the other options that you have out there. So, but number one for diabetes is really get your A1C under control and do it as quickly as you can.
Yeah.
And not just for the erection purposes, but for your overall health. I mean, there's a lot of consequences that come along with that.
Good point. Great point.
Okay.
We got any more questions, or we want to?
Let's see. Are there certain foods you can eat like as a aphrodisiac? I heard like oysters.
I don't know.
I've heard, yeah,
Maybe there's, yeah.
I mean, again, I don't know about y'all, but I mean, I think that what do they call it? The placebo effect. Like if you believe something is, like there. In fact, I think I saw a whole cookbook that was about aphrodisiac foods, and I mean things like avocado and honey and chocolate and strawberries, all kinds of stuff. So, I mean, I personally kind of get turned on by food myself. I just like to eat, but. Yeah, I don't know if there's any scientific backing for that, but I mean the power of suggestion I think is really powerful. What do y'all think?
Have you heard of laser therapy, like with blood flow? Jeremiah, have you heard of that? Or Aaron?
I've heard of it. I'm not well versed on it, but I have heard of it. Yeah.
I've heard of it also. I am a little bit skeptical of that, partly because I don't know a whole lot about it, and it's not something that comes up a lot in the field, and so that makes me skeptical that if us as sexual health professionals don't know a whole lot about it, that makes it's experimental at best.
Mm-hmm.
I
Okay.
agree.
Okay. I think there. Someone said, "Do any of you find that?" Wait, what? Do any of you find that the guy may not be actually attracted to the sex? Like if you're not, well, I guess if you're not attracted to the person, why are we here? Why are you having sex? But men will have sex with somebody just because it's convenient. So that's my opinion. I don't know. What do
I
you?
mean, I guess if we're talking about like in a situation where somebody loses an erection, I mean, I think that's the go-to narrative a lot, is that people assume that means that he's not attracted to me, or they don't, whatever it is I'm doing is not what they are into, whatever it is. I would encourage folks to make that not be the first go-to thought. I know it's easier said than done, but oftentimes it is something else. And if it is the fact that they're not attracted, what are the circumstances around that? And what's the communication? I mean, if you're just on a hookup or something, that kind of comes with the territory. If you're just hooking up with folks and you haven't seen this person face to face yet, and then you all meet, and then the attraction isn't what you had hoped it would be or whatever, it is what it is. I mean, that's kind of what it just comes with the territory, and you don't have to take it personally. It doesn't have to define who you are, but keep it moving. But if you're with somebody on an ongoing basis, the hope would be that you could open up some dialogue about that.
There was a question. It was how safe are penis fillings?
Go ahead, Jeremiah.
Jeremiah.
He's like, oh.
Well, I think it certainly could be safe when it's done by the right medical professional, but you see a lot of just people who are not really should be doing those things that are doing those things. So I would just, if you are going to go in that direction, certainly vet the doctor or medical provider who's doing the procedure. Make sure you do your research.
Yeah, I would want to see some before and after pictures if you're going to go through that procedure, because it gives me like it might be lopsided, if they don't do it the right way, or Does it what like is it silicone or was it Botox? What do they put in there to fill?
There's different types of filler that have different texture, and I'm not actually sure the type that they would use in the penis. But I personally would have a lot of questions and concerns about that because what's the long-term data like? Does it decrease sensitivity? I'm not knocking, I'm not saying not to do it. I'm just saying to definitely do your research before you put something in your body like that. But that goes for everything,
Yeah.
especially your eggplant.
Yeah.
And also, you can check our why about that. What is our narrative about what we already are working with, and
Right.
can we celebrate what we already have,
Yeah.
with before we put ourselves at risk to some procedure that we don't know exactly what the long term ramification is.
I would encourage everybody to, if at all possible, go to first of all, get a urologist, get a PCP, and have that person refer you to a urologist and be able to have those open and honest conversations with your urologist about some of the things that you're experiencing. But it's so important for you to, no matter what age you are, to have a urologist.
Yeah, I had a client who said he got an implant on the tip of his penis to make it wider. Like I was like, God, that sounds like that hurts. Like, but he said he wanted a bigger head, so he got an implant. I was like, wow. Yeah.
I've definitely seen implants gone bad
Hmm.
on the eggplant. So I have seen patients who've had this procedure, and
Mhm.
the fat grafting and the fat transfer, and the fat doesn't necessarily take, but it has sort of expanded the skin on the penis. So you're kind of left with this little turkey goblet, on the bottom of the eggplant essentially. So not a good outcome for everyone. So again, before you do that, really dig deep why you want to do it, vet the person doing it, and that's my recommendation.
Okay. Okay. Josh, what other questions you got for us?
Let's see. So we may have addressed this a little bit earlier, but how can you tell if the presenting eggplant issue is a medical issue or more of an anxiety or psychological issue? How do you go about vetting that in your practice, Jeremiah? And I'll ask you, Aaron, the same thing.
Well, I think the thing that comes to mind is, are they having an issue when they're by themselves? Are they having a problem masturbating? Are they having morning erections, right? If they are having those things, then like you said, Josh, most of the time it is anxiety. But if someone comes in and they're, a 55-year-old, someone who has smoking is the worst thing you can do for erection. So if you smoke, certainly think about that. You're a 40 pack, you're a smoker, you have diabetes, you have poor vascular health. I do worry about those patients and how that is affecting their erection. So it is an overall comprehensive approach to their health. But as a man, the erections are that's important, right? It's an important part of your overall health, not just your sexual health. So I think once you talk about those things to someone, and I don't use it to scare them, but I certainly say, listen, this is something down the road. If you don't get a control now, you're going to have these issues later. You just have to be honest with people.
Yeah.
Yep.
Yeah. We use the ruling out process as therapists and clinicians. We typically rule out, what is actually causing the issue. So if we refer the client to a doctor or to a urologist or to, um, uh, I can't think of what's the physical therapist. We can,
Yeah.
do all exactly. Yeah. So we refer, out, and once we rule out those things, then most times, if we're not looking at, a serious health problem, then it is going to be something that is mental. And so that's when we actually begin to treat the concern.
There was a question about cigarette smoking or vaping, and really what both of those things do. Nicotine essentially can vasoconstrict, can have sort of negative effects on your vascular health of your veins and arteries over time. So really doesn't matter if you're vaping or you're smoking cigarettes. Both of those things can actually impact your vascular health.
Would you say that just with tobacco, or does that go for weed or other smoke like meth, or other What would you say, Jeremiah?
I'm not sure about meth so much. I think it's the nicotine essentially that has that effect on your heart, the increased heart rate. You get plaque buildup over time with smoking tobacco essentially. Now, there's different studies on weed, so there's a little bit of, there's some debate about that.
Mhm. Yeah.
There was a comment said just because it's big doesn't equal great sex. So they're saying embrace smaller penises, you know.
I disagree.
Well, I mean,
Remind you, disagree. He's like, no, 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 no.
I mean, I don't care what equipment you have to know how to use the equipment that you have. And not everybody is as skilled as others in that department. So that's where sex therapy can be helpful, because pleasure enhancement is also part of sex therapy, is helping folks, learn how to use the equipment that they can. And
Mhm.
There's a question that said, are there high risk with using the honey packs? Have you heard of the honey packs?
No idea.
No clue what that is.
Oh, so honey packs are like they treat ED. It gets your penis hard. Like it's like Cialis, but it's in honey form.
Where do you buy those? At a gas station?
Probably. Or at the sex store, like the sex shop.
I don't want to get my ED medicine from where I pump my gas.
Ah!
Good point.
I mean, I will say, like, sometimes they sell those little, I think they're just caffeine drinks or something like that they sell as if there's some kind of sex performance enhancement or whatever. I mean, I don't necessarily put a whole lot of stock in those things, other than it just gets you more energized.
Yeah.
So,
You get listen. You can get them at the sex store. I've tried it before. If you have heart issues, don't do it.
yeah,
Okay.
don't do it. You could just brew a cup of coffee at home and drink that instead.
Good point.
Ah,
Good point.
let's see if there's another question. Someone said they had an experience with someone they were having sex with, and then just suddenly they lost an erection. What do they think that's about?
Mhm.
It can be a variety of things that happen. It can be, something that's physical,
Mhm.
that they maybe having a physical, experience or limitation, or something along those lines. Could be mental. It could be any variation thereof.
Mhm.
What I tell clients on a regular basis, what I suggest to clients, is simply this: it may not have anything to do with you, but it can be your opportunity to support that person in that time. Specifically, if it's someone that, as Josh mentioned, that you're having sex with on a regular basis. If it is, use this as an opportunity to support them and to have communication and walk through what it feels like to continue the process, continue the sexual experience without possibly any type of penetration.
Yeah. Someone would say maybe the hole was too tight. I don't know. Some people like tight holes. Some people like loose holes. Some people like. It just depends on what you like. I don't know. It could be that.
Well, there's Kegel exercises to be able to sort of have, sort of squeeze a little bit too, which could be a real pleasant sensation. I guess the other thing I would say, in terms of, like, we call that sort of circumstantial erectile dysfunction, where in a certain circumstance is when, like, right when I'm about to stick it in, or after I've been going for a few moments, then I lose the erection. What I would encourage folks to do is really examine what is in those moments, what is my narrative? What is the story I'm telling myself? And what am I focusing on? If I'm focusing on myself and, oh my God, I'm going to lose my erection, am I going to lose my, if that narrative starts kicking in,
Mhm.
you're likely to lose the erection, because the anxiety is starting to kind of kick in, as we talked about a little earlier. But one of the things that I encourage, and we use one of the exercises that we use to help folks work through sexual dysfunction, is the sensate exercises. And I can talk more about that, but it's basically kind of bringing mindfulness into the sexual experience. And what I encourage folks to do in those moments is, in order to sort of set aside some of those intrusive thoughts, we want to focus real present tense, and I even be as specific as possible in terms of pressure, texture, and temperature. Focusing on those three things. And what I mean by texture is the texture of the skin or the fabric or whatever smooth or rough? Is the temperature warm or cool? Is the pressure hard or soft? And just because it gives the brain something concrete to focus on in the present moment versus, because if we're asking the brain to sort of set aside, some of those narratives, we need to give it something else specific to focus on. So that's some present tense things to shift our focus again, like we said.
There was a question said, are there ways to keep an erection when implying a condom? So when you're putting on a condom, are there ways to make sure your penis stays hard?
Mm.
Yeah.
Lube, people, use some lube, okay?
Yeah, lots of lube.
Yes. And there are
Well,
different types of lube. Like there's oil-based, there's water-based, silicone. I think I always tell people, like, I love sneakers. Like, I absolutely love sneakers. But the only way that I, know if sneakers are my good, work for me is I have to try different ones. And there are tons of different condoms out there. And you just have to take your time and figure out which one works best for you. There are some condoms that I would never recommend people use, right? I'm like, oh God, that was worse. But you got to find the condom that works best for you.
Mhm.
yeah. And this doesn't
Yeah.
come from something I learned in school, but just personal experience. I mean, I think there is this big workup to get someone right, then get the condom and then put it on them, and then you kind of have that space in between, and there's a little bit of a loss of a connection there. So I think putting the condom on, making it part of the arousal process
Mhm.
is probably really key in that. Like, keep going, keep, if you're giving them oral sex,
Mhm.
do that with the condom on. It may
Mhm.
taste a little funny, but it's just do what you need to do to get your partner aroused.
Yeah, tell the guy to put the condom on for you. Like that,
Right.
that could work.
And be prepared. Maybe you want to have the condom ready to go. You don't want to be fumbling around in the dark with lube slipping and sliding and you can't get the thing open. And then you want to be prepared. Like have it ready, sort of right there on the bedside dresser, wherever it is, easy to reach, easy to slip on. Put a little bit of lube in the tip of it, so there's some nice lubrication inside the condom, and then make them put it on or incorporate it into whatever the hot narrative is that you all have going on. Like, get creative and fun. That's the other thing is like we want to loosen our rigidity around how we think this is supposed to go and just
Mhm.
enjoy ourselves. Sex is
Yeah.
supposed to be fun and connecting and pleasurable. And
There was a question about cock rings and then also poppers.
what was the second part?
Poppers.
Poppers.
Sniff. What are your thoughts about cock rings and poppers?
I mean, cock rings, I think can, they help preserve some of the blood flow, prevent some of the blood flow from exiting the penis. I mean, that's, you're just, all you're doing is sort of stopping, blocking the veins from bringing the blood flow back in. Isn't that right, Jeremiah? Or would you say that differently?
Sure, it helps. It helps to sort of keep the blood in the penis, right? And there's also dangers to the cock rings. So you have to be careful. Having erection for more than 3 to 4 hours, you start to have some vascular issues in the penis, and that can even be considered a medical emergency. So, if you want to need a cock, a ring. Certainly find one that feels comfortable, that works for you, but be careful as well, not to make sure you're just wearing it around all day because you want to.
Mhm.
Yeah, I agree. Same
And
thing with
somebody said they love poppers. What are you all's views on poppers?
Mhm.
Well,
You can answer.
do you want my professional opinion or my personal opinion? I
We will
think.
take both, Jerry.
Both.
We'll take both. Okay.
So when I'm cleaning my VCR, I prefer to use, sometimes I prefer to use a VCR cleaner, especially if you're going to be the receptive bottom partner. That helps. Um, but I also think there are certain health conditions that you should be aware of. If you have low blood pressure, or if you have, there are certain people that even have certain sensitivity to poppers where it can almost cause like a hypoxic situation. So I think talking to your primary care provider, talking to your gay men's health provider about those questions, to let them guide you based on your health, your risk factors. That would be my advice.
yeah,
Yeah.
agree.
Aaron, you were about to add something to that earlier.
No, I agree wholeheartedly with all of you have said. Mhm.
Yeah. And I think we'll talk again when we have our peach conversation next month. We'll probably talk a bit more about poppers at that time.
Cool, cool. What other questions you got, Josh?
Let's see. What what misinformation about eggplant do you want to clear up right now?
That it's always supposed to work.
Tell us more, Aaron. Tell us more, Aaron.
We've been talking about it throughout this conversation. We are not robots. As people who are who have penises, we are not robots. It is always not supposed to work. We love when it works. However, like I mentioned before, there's a whole set of foreplay menus that we can use in order to receive pleasure. And oftentimes, some of them don't require you having or maintaining an erection.
Okay. My one misconception, I think, is, and some of y'all might disagree. I know some of y'all might disagree, but you don't always have to go deep. The prostate is actually only a few inches in. And if you're going way past the prostate, you are missing the pleasure for the guy. So, like, it's okay to pull out a little bit, aim for the prostate, and, like, bang that a little bit. A little bit. Don't kill it. But, like,
Stroke it nicely. Be nice.
stroke it a little bit. Look at the guy's face. See how he's reacting. But if you're going way past the prostate and you're in the second hole, you got heard of the second hole?
Yeah.
Yes. Yeah. Some people like it in the second hole. That's fine. That's fine. You can hang out there, but make sure you come back out a little bit and hit the prostate. Yeah.
What would you say, Jeremiah? Any misinformation you want to clear up right now about?
I mean, I think uncircumcised eggplants get sometimes a bad rap from guys who are circumcised, and I just want to clear the air that I think they're a beautiful thing, and we should stop genital mutilation.
So me and my best friend, we talk about this all the time. I think there's nothing worse in the world than a small uncircumcised penis. Like, if it's gonna be uncircumcised, it needs to be big. I always say, like, it needs to be at least, I don't know, it needs to be big. But like a little 4-incher uncircumcised, I'm like, no, put that away. Anything's that's just my opinion. But if it's gonna be uncircumcised, it needs to be big.
And for those who may have small uncircumcised penises, we love you, and not everybody has the same opinion that Lamont has. So
I'm talking about
own your shit and like enjoy it, and
Yeah.
Oh, somebody said they 200 agree. They agree. There's like, if it's gonna be, it needs to be big. I'm just saying. Call me a size queen. Okay. Oh, there's some more questions. Let's see. If you suffer from low testosterone, do testosterone injections affect your sexual health? Are they safe? What do you think?
Good question. Jeremiah, go ahead.
I'll take that one. So I think the question is, if you have low testosterone, is that going to affect, I guess your erections, your libido? And the answer is absolutely yes. There have been some debate in the past about, supplementing someone's testosterone. If you have low testosterone and you have low symptoms of testosterone, it is absolutely beneficial to supplement that. The problem, is when you already have normal levels and you're going above that, that's also a problem. So I think finding that middle ground where you're in that normal male physiological level, and what's normal for one person may be a little bit different from another person. You have to also look at age. What a normal testosterone level is for a 30-year-old may be a little bit different for a 45-year-old. But when we're running those levels, to be quite honest, the range is from like 300 to 950 is normal. So you really have to put on your thinking cap and look at someone's whole health and see what symptoms they're having and have that discussion about what would be best for them.
And again, always looking at I think you were saying this, Jeremiah, looking at the broader factors that are going on in one's life. Are they carrying a lot of anxiety? Are they depressed?
Yeah.
Do they have diabetes? Do they have, all the other things that we've talked about? Those also, we can't just hone in on one factor without taking everything else into consideration and come to an accurate diagnosis
Yeah.
of the situation.
And carrying extra weight, and this is sort of like chicken or the egg, but carrying extra weight definitely affects your testosterone. If you have more body, and more tissue and more fat, that just dilutes the amount of testosterone you have. So I have literally seen guys lose weight through diet and exercise and other means, but their testosterone levels then come up, their libido increases. So again, I also understand that guys who have low T maybe having a bit more of a struggle to get to the gym and to have that sort of motivation. And but again, that's something that you can work with your provider on.
Have y'all heard of morning wood? Someone wants to know, is it abnormal to wake up without an erection? Like no morning wood. Is that abnormal?
It's not abnormal, but your testosterone levels typically are highest in the morning. So if you are going to have just a spontaneous erection, it usually is in the morning time.
So get that wood in the morning. If
That
you're
would
trying to get your guy, get him in the morning. Let me see if there's another question. If you get an erection from masturbating, but not always finish, would it be a mental anxiety or ED? So you're getting an erection when you're masturbating, but you're not always climaxing. Is that
And the question is whether that's bad
yeah,
or.
anxiety or is that ED? What is that about?
Mhm.
You want to take this?
Aaron, why don't you go ahead and take a stab at that?
It could be a mixture of different things. It could be anxiety, it could be erectile dysfunction. It could also be that you're not necessarily receiving a ton of blood flow. And Jeremiah, please correct me, of blood flow to the extent that you're going to ejaculate. So it could be a mixture of all of those things. But please correct me if I'm wrong.
I would just add to that, it could be medication side effect. A lot of the SSRIs like Zoloft and Paxil and those antidepressants, those definitely can make it more difficult to have an orgasm. In fact, that's one thing you should look out for and talk to your doctor about if you're having those side effects. But I think for a lot of people, stress is a major factor. If you're just
Sure.
your brain is somewhere else and you can't be in that moment for those 5 or 10 or 15 minutes, you're probably not going to be able to really finish.
hmm And also, how many times is one masturbating per day? How often is that happening? Are we giving ourselves enough time
Yeah.
to? I mean, it's kind of like I love to use food analogies when we're talking about sex as we are today. If I eat um, if I eat lobster every single day, it kind of loses its magic a little bit. I love lobster, I love shrimp, I love sea bass, all those things. But if I'm eating it nonstop all the time, it doesn't. It's not as magical. It's not as something to look forward to. And I think the same thing is true for sex. Is that if we are, jacking off 4 or 5 times a day, if we're having sex several times a day, nothing wrong with that. But if we're noticing that the intensity of those orgasms or the intensity of those experiences is waning a little bit, maybe we delay gratification just a little bit as well.
Yeah.
There
Which
was
is
a
a good
question. Go ahead, Aaron.
No, I was just going to say a really good point. And I don't know if Josh was alluding to this, but I'm wondering in terms of edging.
Oh yes,
Um,
yeah.
are we, are we practicing edging? Edging is a really good way of delaying gratification, as Josh mentioned, as well as increasing pleasure.
Mm.
For sure.
There was a question about nocturnal ejaculation. Is that normal at a certain age? Like, can you explain what that is? How often that should happen or not happen?
Mhm.
I mean, I think it's normal. I think it just means you're having, extra ejaculate that is maybe coming out at night when you're having a wet dream, or, maybe you're just lost in the sleep. But I wouldn't read that as an abnormal thing.
Okay. So it just means you're working properly. You're good.
I wouldn't complain.
Unless your sheets get messed up. Okay. Josh, what else you got? Like, no, we've been here for almost almost an hour.
Yeah, so here's one that I think is actually a really important one for us to address. How do we help people have better perceptions of eggplant in relation to masculinity and femininity? One of the things, some of the language I've heard us use, even in our conversation tonight, is language around people with penises. Obviously, there's transgender folks that kind of identify all across the spectrum. And then also we hear this thing about sort of top energy. I'm not getting top energy from this guy, or whatever it is. And I wanted to kind of just drop that into the conversation a little bit about just again, how do we help people have better perceptions of eggplant in relation to masculinity and femininity?
That's a loaded question. Nope.
Very
But
much.
an important one.
I struggle with this question, to be transparent. But I mean, I can tell you some of my thoughts is, I think, we normally think of a penis as masculine. And I even had to question some of my own thoughts about that, because is it because it's an insertive instrument, and that carries more power or strength, and that's something that we're associating with masculinity? But then I thought more about it, and I thought, well, a penis isn't necessarily inherently masculine. It can certainly be feminine. And I think, as you pointed out, Josh, you have trans men, I'm sorry, trans women with penises, and that can be a very feminine thing for them. So I think it really depends on the person who owns the penis and how they choose to represent that energy.
Yeah, definitely.
Have you ever heard of soft tops or blouses? You ever heard of blouse?
Yes.
Those are feminine, like presenting tops that, like, they might, wear some pearls or a necklace and some makeup, but they topping the guys, right? And I did this post not too long ago. I was like, those are the guys who are winning, because they are eggplanting people down. Right? I can't say the word I want to say, but you'd be surprised. Like, there are some femme tops that guys absolutely adore, and it works. It works. So
There's certainly, I think, a subculture of men, cisgender, heterosexual men who are, maybe exclusively attracted to trans women who have a penis, and they want to be, pounded through the wall, and that's fine. I think I find that a very interesting dynamic, and one that is a little bit maybe foreign to me, but I think that I'm so happy that people can enjoy all of those things.
Yeah, I think, to your point, Jeremiah, and I think to your point also, Lamont, I think we can get out of this heteronormative mindset that, having a big penis, it equals masculinity. What we can talk about is, as we've been talking about all night, how do you use that? How do you use the penis? How is it benefiting and working for you? I thought about, when Lamont was describing this, I thought about automatically BDE. You can have a small penis and still have BDE. So let's think about, how do we actually use what is given to us, and how do we please ourselves and our partners?
Yep. I think the other thing I would just add to just kind of expand on what was said is, there is erotic narrative around our sexual encounters, whether we recognize it or not. What is like let's say I'm hooking up with somebody I don't really know. And I see what they're wearing. I see the way they carry themselves. I see the way they talk. I see the way they breathe, the way they move their body. And I create a bit of a fantasy in my own inner world about what that means, and I project it onto that person. And so I think a lot of times there is kind of a fantasy of the taboo, or there's a fantasy of, no, this is kind of a secret, or this is something that not a lot of people do, whatever that is. And that can be erotic for some folks. This either unknown or something that's not common, or whatever the fantasy might be, is something that I think I think it relates to the masculinity femininity spectrum, is that we project meaning onto whatever that whatever we project meaning onto the whole spectrum one way or the other. And not everybody does it the same way. I mean, that's just as to Jeremiah, your point, there's some, cisgendered so-called, straight guys that, like to, be with trans women. They have a narrative about what that means, and it's hot for them. And we all do as well.
Yeah, some straight men like to get pegged, right? By their female partners. Yeah.
Yep.
Yeah.
Indeed. Well, I've got one more question. I don't know how much time we got, Lamont. I could keep going all night.
We can do one last. Apparently, he can go all night, people, and he's single.
That's right. So actually, I want to say two more questions. One, which I think is important, is how have you noticed people's perception of their eggplant? How does it change with age? Have you noticed any, just sort of as people get older, their own perception, or just kind of what have you noticed? I'll put that out there in terms of age.
Go ahead. I struggled with this one, Josh. I think I deal with sort of a narrow age range between 25 and 55 is sort of my average patient. So I haven't personally noticed any major shifts in how people view their own eggplants and others. I have certainly had older patients make comments about how things get smaller as they get older and certain things get bigger. So, like your nose and your ears get bigger, and eggplants tend to get a little smaller. So, I think that's a shift, but I don't have any other, comments on that.
Yeah.
Yeah, I think the shift most often, especially with my older clients, regarding their testosterone, that is the biggest question that I have, or that they have for us. Is it supposed to, like, am I always supposed to be horny? I'm not like I am in my 20s anymore. And oftentimes, it's understanding that the aging process can, as Jeremiah alluded to, can contribute to shrinkage. It also can contribute to lower testosterone. And we have to be able to talk to our clients specifically about how this is affecting them and this is affecting their sex lives.
Yeah, I think older guys will do everything in the world to make sure that thing works. Whether it is going to the gym, taking a pill, they will try anything, right? They're like, because there's this expectation that it's supposed to stay hard all the time, like they were like 17 or 20. Like it's like, no, bro, you 50. Like, like you're 50. You're 50. Like it's okay for it to change a little bit. So I tell guys like give yourself a break, and just try to relearn your body and kind of redefine sex for you so that make sure it's pleasurable for you. Because we don't want you having a heart attack trying to make that thing stay hard. Yes.
No, we don't want that at all. I think the other thing I would add is really there is a lot. Change happens, over the course of one's life, and in the fullness of time, our bodies inevitably change, and death comes to all of us, And so, as we are moving through the various life cycles, our relationship or the way that our eggplant performs or our eggplant sort of functions naturally shifts. And that doesn't have to be a bad thing. I think one of the things I encounter all the time is people expecting at 65 to be having the same kind of sex that they had at 25. And, the entire body is a pleasure playground if we but enter it, if we but use it. And that's one of the things that it's just really a lack of creativity in many ways that, that the eggplant is one piece of a much bigger sort of pleasure puzzle. And so, as folks age, let's see it as an opportunity to get creative about how we incorporate our entire body and our entire soul and our entire heart into what we're doing. So that's one thing I'll say. And then the last question I'll put for everybody: what is it about eggplant that is so interesting?
It is the best thing that God has created. I'm gonna well, it's my opinion.
I think we as men, we are fascinated. Even heteronormative, heterosexual men, we are fascinated by the shape, the size, smell, the taste, the touch, and the feeling.
And the pleasure.
Why? Yes, yeah, all of that. We are, because it is, sexual organs are very fascinating to all of us. Let's think about that. And so, I mean, even when you guys probably remember this, even when you're younger, when you're 4, you're 5, you're 6, and you may see, your cousin or brother or sister, and you're looking at yours and you're looking at his, and so on and so forth. It is a fascinating thing, and it always piques curiosity. And honestly, it should always pique curiosity. The eggplant, the banana, whatever we want to call it, is a beautiful, beautiful, one of God's best creations. Let's be honest.
That was beautiful.
Oh, somebody said, "What are we talking about? We talking about eggplants, people." Okay.
Yeah.
Mhm.
What were you going to say, Jeremiah?
Oh gosh, I think for me, I'm just answering this from a personal perspective. What I find so interesting about an eggplant is how it's so dynamic and it's changing. It can start off one size and one shape and transform into this completely different thing right before your eyes in a matter of seconds. So to me, that's a pretty cool feature that we have.
Definitely. Any thoughts, Lamont?
Oh no, that's it. We have 25 seconds before Instagram kicks us off.
Okay.
Seconds.
Well, I'm grateful for this conversation. I'm really what a great night and what a great conversation. And we are going to be having a similar conversation about peaches next month. And I hope to have all the same panelists back. But thank you all so much for giving your time and expertise to our conversation this evening.
Thank you, fellas. Good night.
Good night.